Nice to meet everybody. My name's Andy Wilshaw. I'm the Community Development Manager for Adult Social Care at Stoke-on-Trent City Council, and I oversee the community lounges within the city. So I've got a little presentation. I'll just try and share it. Bear with me because I'm usually used to Teams. Can anybody give me a nod or a yes if they can see it? That would be perfect. Yes, I can see a few people. I can see Charlotte. Thank you. So this morning I'm going to talk about community-led support, communities together, community lounges, a little bit of everything. So I can see lots of familiar faces within the meeting today that'll know a little bit or a lot about community-led support. So I'm going to give you a quick whistle-stop tour about what we're about, what we do. And I want to start off by making it perfectly clear that this is a collaborative approach. It's about co-production. It's about everybody working together on a level playing field to support the community within Stoke-on-Trent. So the Communities Together logo that you can see there was co-produced with services and members of the public within Stoke-on-Trent. You can see the black and white and the red and white to represent the two football teams within the city. I think I've seen Gemma on the call. Gemma, I apologise. I've got the Britannia Stadium behind me. It's my little boy's room. But yeah, it's a co-produced logo right from the start. So what is Communities Together? Communities Together is a vision for Stoke-on-Trent that all communities, move this, are vibrant and inclusive, where people are aspirational and feel a sense of belonging and pride within their places. Again, our model is very, very similar to the places of welcome. I think I've seen Leslie on the call as well. So Leslie and I work together. Anyone that requests to be a community lounge, I very, very quickly say, if we can't be a community lounge, can you work with Leslie, be a place of welcome? And it's about connecting the dots together to make sure that everyone's delivering together. So the approach involves a network of over 50 organisations from the public, private and voluntary sector, working in partnership with their communities to design and deliver different ways of working which maximise the strengths of community connections with people locally. And it's about having a good old chat with people. The amount of times we get feedback from people that attend community lounges that say, I'm sick to death of having to pick up a mobile phone and speak to a robot. I've got to go on the internet and I don't really know how to do it. So it's been having that human touch, speaking to somebody on their doorstep within their local community and actually actively listening about what's going on for them and what are their issues. And this then hopefully will lead to on-the-spot action where locality connectors or any other service within a community lounge will be able to support somebody, and hopefully they walk away feeling a little bit better than when they arrived. It references there the innovation team, and again, there's lots of people on this call who are part of the innovation team. The innovation team are a team of professionals that meet within each area, so within each locality, to discuss the service delivery of community lounges and community-led support. So what's working well, what isn't working so well, are there any further opportunities to make a difference within the community? And the community lounges are based in strategic areas across the city, offering advice and support. So when Jill O'Hare set these up in conjunction with partner services, probably about 3.5 years ago now, she was very, very keen that they happened where people already attend. It's not about us as a local authority thinking we know best, trying to dictate what goes where. So a lot of the community lounges are within food banks, they're on community centres, so where people are already going with the trusted venues. I think I've seen Helen from RVS on as well, and we've got Gemma from Port Vale, so already established, well-respected venues. I've discussed the innovation teams. Again, I've discussed there are already trusted places where people go. Significant links with health services. Again, I've seen Mark Cardwell on from MPFT. Really strong, trusting relationships with partner services. I've been in post for 10 months now, and when I first came into post last year in April, I had a meeting with Tom, and Tom gave me lots of valuable advice and guidance around really, really genuinely connecting with services, connecting with the hosts that host the community lounges. And I hope that my time in post that you've seen that I'm a human being. I'm nice. I'm down to earth. What you see is what you get. There's no cloak and dagger. I want to be out there. I want to be supporting. I want to have my finger on the pulse within the community lounges, hearing what people want and working together. So that feedback and advice early doors, Tom, was really, really beneficial. Thank you. It's about us being incredibly grateful to people like Helen at RVS and Gemma at Port Vale and all the other lounges, because you're the ones that put the lights on, have the electricity on, and you allow us to come in and hopefully add value to what you're already delivering. So it's a big thank you from me there. We've got one of the locality connectors in the corner there. That's Rob. Rob covers the central locality. Again, this is a little bit of a slide around vision. We work closely with NDTI, which is the National Development Team for Inclusion. They've given advice and guidance all the way through this journey around vision, are we doing the right thing, and acting as a critical friend. So again, all the buzzwords I've already used. It's about true co-production. It's about working collaboratively. It's about looking at what the community are already doing well and building on that. Thinking about community hubs. So we link in very closely with Donna and her team within family hubs and the family advisors. I'm really, really keen that we're not duplicating service delivery. There's lots and lots and lots of different organisations out there doing similar things, but we need to work together. We're all working so hard. I don't think we can work any harder. Someone said to me, we've got to work smarter, and I latched onto that straight away. We can't work any harder. We've got to work smarter together. And I think that's the way forwards. Again, this is a map of deprivation across the city. Really sad to see, really, but I think anyone who works in this type of field can see that that's the Stoke-on-Trent area, mainly most deprived or the next deprived area. The arrow is pointing at the Burslem ward, which is where the first community lounge pilot area was, and that was Port Vale. That is an absolutely thriving, even without us, is an absolutely thriving building at Tommy Cheadle's Football Club. And I can't see Gemma, but it's fantastic. The numbers they get there on a Friday when we're at Tommy Cheadle's is anything up to 50 and 60 people. And the setup there within the community lounges, you've got a safe, warm, welcoming space where people can come in. It's free. They can get a hot drink. They can get a breakfast. They can socialise. So if people are lonely and isolated, they can come along. The staff there are absolutely fantastic, as they are in any other lounge, making people feel special and helping them. So they've got that area, the lounge, exactly like someone's living room, really chilled and relaxed. And then just through the doors, the other side, we'll have lots of different partner services. So STR workers, mental health workers, employment advisors, locality connectors, lots of different services that the venue and the partners have agreed that the community need. It's not about me or anybody else saying, right, we think we know best about the community. It's co-produced and it needs to be the right service. We can't just pluck lots of services out and go, right, I'm going to chuck loads of services at this venue and hope that they stick. That is the absolute opposite of what we're trying to do within the Communities Together framework and model. Again, I've put this slide on. This is a City Council slide, but what I wanted to show, I'm pointing at my screen, you can't see, you can probably see my pen fiddling around. Community is right in the heart of what we do. And so it should be, because the community are experts in their lives. They've got the lived experience that we should be listening to shape services. Again, a little phrase that I absolutely love. If you always do what you've always done, you'll always get what you've always got. And this model is doing something. This is doing something different. It's not thinking about the normal ways of engaging with people. It's everybody working together in the community, and it works an absolute treat. The community lounge schedule is there down the side. I can send that. If I can send that to you, Charlotte, if you can pass that around to everybody after, that'd be marvellous. There's 18 across the city, as I've mentioned. They're all very different. to meet the needs of the local community. So we've got food banks, community centres, RVS, neighbourhood centre. We've got Asher at Hanley, which specialises in asylum seekers and refugees. So they're all really, really different, and we're not perfect. We're not perfect. We're on a journey. We've got a bit of a plan, as you'll see at the end, but hopefully we are trying our absolute best to make sure that they are serving the needs of the local community. They're between 1 and 2.5 hours long, so not a huge amount of time, but sometimes that might be the only time that people get out of the house and socialise within that week. So it's really, really nice. I've already spoken about really what community lounges are and what they're about, so I won't labour on that. What I will say though is I've seen kind of a little shift in attendees within community lounges. So originally when they were set up 3.5 years ago, they were exactly what they said on the tin: a community lounge, the living room, the safe space for a tea, people to come along, like a chatty cafe or something like that. Because of the trusted relationships that have been forged with partner services and the community, we're seeing an increase in the complexity of cases coming through now. So for me, it's a true partnership and model around early intervention and prevention. Can we work together collaboratively to help people before they get to further down the line and they need that more acute and more expensive intervention, really? So that's the model. Again, a slide. So many partner services. If you're not on there, I do sincerely apologise. But we work with lots and lots and lots and lots and lots of partners. Just quickly about the locality connectors. So the locality connectors are the team that I manage. There's 5 locality connectors. The North locality is Steph Lancaster, Central is Rob Little, South East is Sarah Picking, and then we've got a job share in the Southwest, which is Julie and Karen. Their professional heritage was that they worked for adult social care as support workers, transitioned over into locality connectors to be part of this community-led support model. They know a little bit about more or less everything. They don't pretend that they're experts, but what they are good at networking. So if they can't help you there and then, they'll know somebody and put you in touch with someone that can help. Slide just giving a quick overview of all the different things that we can support with. And as I've mentioned, mental health, fuel and food poverty, housing, benefits, domestic abuse. I won't read them all, you can see them there on screen. But we never know what's going to walk through the door within a community lounge, because we are completely inclusive, it's universal, it's free. Again, just a couple of examples of what difference we make. That's lovely Irene, she's 94, Irene is. Irene comes to the Bentley Community Lounge, and Irene said that coming to the community lounge makes me want to get up in the morning. I know I'll get some company and advice and help. It keeps me fit and active. I hope people will start coming and using the lounge because there's nowhere else like this. I have to disagree probably with Irene, because having spent time in this role, there's lots of other things like this. We've probably heard of lots and lots and lots and lots of different things, but it's lovely for Irene to say that. But again, it's about Tom and I and all the other partners around this table joining up those dots to make sure that everybody knows what is out there. The next one is a little bit more hard hitting, and this was a text that somebody sent to a locality connector. So, morning, Steph. I just wanted to send you a text to let you know my progress in the refuge. I can't begin to thank you enough for helping me here. The day I came into you, homeless and broken, was the most scariest and lowest point of my life. You dropped me off at the train station that day, and it was the turning point to start living my life after trying to end it on so many occasions. If it hadn't been for you that morning, I dread to think where I'd be now. I'm still in the refuge and love it. I'm here with other women and other staff. We've all become good friends, and they are like my family. Again, I won't finish off reading that, but again, we're getting so many different outcomes, and I'm really, really conscious that since I've been in post, that we're building a picture, we're gaining more data. It's not all about data. We're dealing with human beings, and that's ultimately what we are doing. But if we're honest about supporting the community and listening to the community, we need to be using what the community are saying to shape service delivery as well. So just wanted to reference that. And next steps, I keep using co-production, co-production, co-production. Hand on heart, are we really co-producing? The answer is no. And the answer is no, because my professional heritage within family hubs, as we've seen Donna, is around governance, parents' forums, partnership boards. If we haven't got people with lived experience on these boards, we're not truly co-producing. So the next steps within communities together is that I'd really like people that are attending the community lounges to be on the decision-making panels. That's where we need to be. People mystery shopping the community lounges. It's all well and good me saying, yeah, I think we're making a difference. Well, maybe we're not. Maybe we need these people to tell us and give us some advice and guidance. Coming along today is about building new relationships, meeting new people, but also building on the strong relationships that we already have. One of the other steps we're looking at is working in conjunction with VAST to think about 6 monthly check-ins with all 18 community lounges. We've got the innovation meetings, but they can be quite broad. They're very productive, but I want to give the community lounges some precious protected time to talk about them. How are they doing? Is it working for them? What's working? And how can we potentially support them better moving forward? Linking in with Natalie from VAST around if there's any training needs and that kind of stuff. We've also worked with the NDTI, which I've already mentioned. There's lots of training opportunities that can potentially be rolled out for the VCSE sector. So that's hopefully coming. And then finally, linking in with other groups, like Irene says, there's not much anything else out there. There most certainly is. So it's about working together. And if somebody needs support on a Monday, a Tuesday, a Wednesday, a Thursday, we all know where someone can go. And it's not about there's only a community lounge on this day or there's only a place of welcome this day. So really, really joining the dots and working together.